Well, a huge gap in care is inspiring an entrepreneur in Lafayette to open a speech clinic focused on kids. Trent Terry came face to face with the unmet need when he struggled to find speech therapy for his young daughter. Business of Health reporter Kylie Veleta has more. Kylie.
Thank you, Gary. Terry and his business partner, Mindy Hibbert, launched Therapy Solutions about 4 years ago with just 2 therapists, and the small company has now grown to more than a dozen therapists on staff and nearly 40 independent contractors throughout the state. And demand continues to climb. Therapy Solutions is referred about 50 kids per week. The small company relied on school space and home visits for therapy sessions, but is now opening its first clinic in Lafayette to treat more kids. Trent Terry joins me now to tell us more about his vision for the new clinic. Thanks for being on the show today.
Yeah, thank you. Glad to be here.
All right, so let's talk about, first of all, how your company got its start and a lot of early growth that you've been seeing.
Yeah, it's very exciting. So my daughter was born in 2017, and she needed some early intervention therapy when she was about a year old, and I had called around and unfortunately was met with a lot of wait list or delays in order to get her the treatment that she needed, which as a parent you can imagine is very frustrating. So fortunately, my now business partner, Mindy, lives just down the street, and she's a speech pathologist. So I reached out to her about providing the therapy privately, which she was gracious and did so. And now my daughter's great, the therapy worked. But throughout the course of that, Mindy and I got to talking and decided that I had a business background and previously owned other businesses. And she, being a therapist, was ready to take the next step. So we partnered and formed Therapy Solutions, and now we're serving children all across the state of Indiana. So it's a very good feeling.
It's a great business story. And you noticed a real gap in care for kids between the ages of 3 and 5. Explain how that gap really helped expose a need to have an actual clinic in Lafayette.
Yeah, it really did. So we started our company working directly with schools, so K through 12. And then we decided that we wanted to go to a model to where we could help a child from birth to high school graduation, potentially even with the same therapist in some cases. So as part of that, we grew into doing first steps, which is early intervention therapy through the state of Indiana. And we started that about 2 years ago, and we noticed that we weren't still quite meeting our goal of birth to high school graduation for providing services. And as we started talking to some of our parents, they said that where do we go once our child reaches 3 and they can't have early intervention services anymore? And we found ourselves referring to other places that had wait lists and things like that. And so we decided that we could fill that need if we purchased a building and opened a private clinic. So we're in the works of doing that now.
And we mentioned that you have contractors throughout the state, so you're doing work even outside of Lafayette to meet that statewide demand, but you're hopeful that this first clinic in Lafayette could open the door to other clinics. Can you tell me a little bit about that?
Sure. We're very excited about the potential of growth over the next few years. We're committed to the state of Indiana and the parents and children in Indiana, so that's going to be our focus. We don't even have the doors open on the first clinic yet, and we've already had requests from other cities and other parents to open clinics in their areas. So I think the need is clearly there. We just need to make sure that we're smart about how we grow the business. But we're very excited about the potential to continue to serve other areas in the state.
Hoping this first clinic can be somewhat of a model for some future clinics.
Yes, that's the hope.
Your company really prides itself on providing really personalized therapy, really individualized for each patient. Could you talk just a little bit about that?
Yeah, sure. So, our company exists to serve the parents and the children. And something that we really talk to our therapist about is we're not just doing a job, we're helping a child for the rest of their life. And the work that we do has a direct impact on their quality of life for many years to come. So we take that very seriously. One of the things that we do from a quality control standpoint is we'll take samplings of parents and we'll call them and just say, how's it going? Are you happy with your therapy? And so we get some good feedback that way. Another thing we started in the height of the pandemic was we started a parents council. And so the parents council consisted of a group of parents that were transitioning to teletherapy because of COVID, and had a lot of concerns about that. And it was myself as the CEO and Mindy as the other owner that headed up that parents council, and allowed a direct access line from parents to the decision makers at the company. And we learned a lot from that. The parents loved it because they offered us a lot of suggestions. And then it also ended up being kind of a cohort group of parents in similar situations that would email each other with questions and things like that too. So it's kind of a unique concept that really took off.
All right. Well, I know your clinic is really looking forward to opening its doors, likely late spring or early summer. Congratulations on your first clinic. Keep us posted.
I will do.